Good afternoon and welcome to CAN TV Cable 21. Hi, my name is Lucy Aquino and I am with Hispanocare, a program of Advocate Illinois Masonic Medical Center. And today we have with us special guest Dr. Andrew Albert of Illinois Masonic Medical Center, Gastroenterologist. Thank you for being back on the show.
Thank you for having me.
Well, today our topic is really going to be interesting because not only do we want to catch up somewhat a little bit on colon cancer because it's colon cancer month based on our last show, but we also want to talk about acid reflux. But Dr. Albert, thank you for joining us again and taking the time. I know that you're quite busy and we really do appreciate you coming out. So can you tell us a little bit what's going on based on what we discussed the last time on colon cancer and colon cancer month?
Sure. So March is Colon Cancer Awareness Month. We want patients and their families to know how important it is to get a colonoscopy. A colonoscopy is an exam of the colon to look for growths of the colon that would otherwise become colon cancer. So we'd like to remind everyone, like we mentioned on our previous show, that colon cancer affects 1 in 20 people and that it can be prevented by having a colonoscopy. People over the age of 50 require a colonoscopy. There are no exceptions. And it is important to be diligent about seeing your doctor and asking them to have the exam done. This way we can prevent colon cancer. And I'd say approximately 60% of people get their colonoscopy only. If we can get a much larger percentage, if not all, to have their colonoscopy, that would be fantastic.
Doctor, I did want to remind our viewers, and correct me if I'm wrong, but if you have a family history of polyps or colon cancer, should that screening be done at an earlier time?
So that's a great question. If there is a family history of colon cancer, parents or grandparents, patients are encouraged to have a colonoscopy at the age of 40. So 40 years old is when people at higher risk, there are exceptions, which you can discuss with your doctor, would need a colonoscopy. So great question.
Well, great. And for our viewers, I do want you to know that our lines are open. If you have questions for Dr. Albert, please give us a call. The number's at the bottom of your screen. So, Doctor, thank you for the reminder. And I do want to remind our viewers as well that since it is colon cancer month, we do have a program free of charge. It's happening, being sponsored by Hispanocare and Illinois Masonic Medical Center. And we have you speaking as well as your associate, Dr. Flicker. So this program is happening for colon cancer awareness lecture Saturday, March 28th, with registration at 9 o'clock, the presentation at 9:30. Refreshments will be served at Illinois Masonic Medical Center in the Center for Education building. Should you want to register for this event, you can actually give us a call at 1-800-323-8622 or 1-800-3-ADVOCATE, where you can register for the program. Thank you so much. Meanwhile, Dr. Albert, acid reflux. I know that that's our topic today, and it's a really important one. We hear a lot of things that are happening with acid reflux. We hear that folks are actually taking so many over-the-counter drugs, your Tums, your Alka-Seltzers, your Pepto-Bismol, and all these things, but yet it never takes care of the problem. So, Doctor, can you tell us what acid reflux is? But before we do that, can you tell us what a gastroenterologist is?
Sure. So a gastroenterologist is an internal medicine doctor who specializes in the GI tract. Someone who focuses on the esophagus, the stomach, the small intestine, the large intestine, and parts of the lower large intestine. And what we do is we diagnose problems associated with any of these areas, and we provide treatment, evaluation. So if you have a tummy ache, we'd be the person you'd see, or various other problems. But we basically take care of your digestive system and focus on that exclusively.
Oh, which also ties in with colon cancer
Correct.
as well, all right, for colonoscopies.
Yes.
But going back to acid reflux, which is what our topic is about today. So what is acid reflux? I mean, you hear the term GERD or acid reflux, but then you hear so many other things about it too, and it can be so many different things potentially. Can we discuss that a little bit?
Sure. So GERD is gastroesophageal reflux disease. Typically, many people have reflux of contents of their stomach, including acid, up into their esophagus in very mild degrees. The reason it becomes a disease is when the symptoms persist into a stigmata of pain, regurgitation, sour taste of the mouth, indigestion, feelings of discomfort in the belly. So basically, acid reflux is the symptom you get, or rather, GERD is the process of having acid reflux up into your upper GI tract, which patients experience.
So, when you have acid reflux, we talked about what it is, and so what are some of the symptoms that are related to acid reflux or GERD?
So patients who typically have long-standing GERD experience issues with their teeth. A lot of patients will have their enamel gone, and the dentist will say to them, I noticed that your enamel is gone. Do you have acid reflux? And patients will often come to me as a referral from their dentist. Some patients will have pain in their chest that they think is like a heart attack, but sometimes can just be burning of the acid on the esophagus. Some patients will have a bellyache. That's worse with eating, sometimes worse without eating. Those are the main symptoms of acid reflux. Maybe waking up with a cough in the middle of the night or feeling like you're choking. Those are some symptoms of acid reflux.
Now, is it also a symptom that if someone is suffering from acid reflux, is it also a discomfort and or irritation of the stomach after they have a meal?
So they can have discomfort of their stomach after they've eaten a meal from high levels of acid, which burn on the inside, because a meal stimulates your stomach to make more acid. And some patients feel that when they eat a larger meal, they have more reflux, partially because their stomach is full of food and pushing acid up, and partially because the food stimulates your stomach to make more acid. So it's one continuous cycle.
I've also heard that sometimes the pain can be excruciating, where it comes up to your chest and you think you might be having a heart attack?
Correct. Some patients come to the emergency room and they're given what is called the GI cocktail. Oftentimes, if it is acid reflux related, the GI cocktail in the emergency room makes that pain go away. You can imagine the ER has a whole protocol for evaluating reflux versus a heart attack.
Right.
But either way, both symptoms, or rather the symptom from both problems, should be evaluated by your doctor, and you should talk to them rather than just taking over-the-counter remedies.
Absolutely. Especially if the counter remedies are not fixing the problem or alleviating it, where indeed it's either worsening through time.
It's ironic you say that, because often patients take medications over the counter, and the box for the medication says to please notify your doctor if you have the symptoms persist 14 days and you're taking a medication over the counter. So you should absolutely talk to your doctor and make the time to make it a priority.
Especially if it continues to persist.
Correct.
I mean, it's something, if you're not getting any relief from over the counter and your OTC things, you need to follow up with a physician.
Correct.
Again, I want to remind our viewers that with me today is Dr. Andrew Albert of Advocate, Illinois Masonic Medical Center, gastroenterologist, and our topic today is acid reflux. Our lines are open. If you have any questions for Dr. Albert or for myself, please give us a call. The number's at the bottom of your screen. So I know that some of the other symptoms, at least I hear, are nausea, which is a big part of that, or I even heard weight loss.
So nausea is a symptom that one may get when their stomach is irritated, and upon being taxed by food, you could have nausea. And as far as weight loss goes, weight loss is a different category of symptoms. Weight loss is pretty much 100% alarming symptom to doctors. If you're not intending to lose weight and you have acid reflux, oftentimes the weight loss is a concerning symptom, and you should have that checked immediately.
Absolutely, because that sounds really serious.
Yeah.
Doctor, we have a caller. Caller, you're on the air. Oops. We lost our caller. Please call back. Doctor, when should someone seek treatment for acid reflux?
So I think, like I said earlier, if the symptoms persist more than 14 days, I think with therapy or just in general, one should seek medical advice. Some other warning symptoms to think about, which I'd like you to remember, are if your stools change color. Sometimes if there are high levels of acid or indigestion sensation, that may be seen with an ulcer. And frequently patients ask me, do I have an ulcer at the same time that they have indigestion? So dark stools that change color to a dark, dark, dark color, almost tarry, if you will, blood in the stool, weight loss, lack of appetite, those are true warning symptoms, or just frankly continuous pain.
Burping? Is that part of it too?
Burping is part of it, but burping is not generally a warning symptom for us, although burping is a symptom of acid reflux, potentially, or GERD, and if it continues, you should seek medical assistance, but not the most concerning symptom that we see in gastroenterology.
So, doctor, what happens if acid reflux is left untreated?
So if acid reflux is left untreated, there are some concerns. The lining of the esophagus is very fragile, and the stomach is a more robust lining. And what happens is the acid will burn the lower half of the esophagus and cause one to develop a condition called Barrett's esophagus. And Barrett's esophagus is the name of basically the change of the lining of the esophagus to a different kind of lining to protect itself. But while it does that, it actually increases the risk of cancer. And so Barrett's esophagus is what we consider a pre-malignant condition or pre-cancer, and that could happen with chronic reflux. Additionally, one could have ulcers of the esophagus, which can cause chronic pain, discomfort, bleeding, weight loss. So that's a significant sign, in addition to the cough and the dental decay that could happen as well.
And these are what are the complications, or are there complications to follow in addition to what you just said?
A lot of those are the biggest complications and the biggest concerns that we have. Really, ulcers and Barrett's esophagus are our biggest worry as GI doctors, and chronic reflux can lead to these things.
Oh, so acid reflux, how is this actually diagnosed? Is there testing for this, or is it, again, looking at the amount of the OTCs, over-the-counter drugs you're taking? Is there an actual exam for this?
So there are a couple of things you can do. You can diagnose by history, which is where you talk to your doctor, and the doctor diagnoses you based on the pattern of your symptoms and says, you have reflux, and this is a medication you can consider. Or you can try dietary change, maybe not eating late at night, and we can get into this later. But the diagnosis includes taking a good history as a physician, or you can do a pH test where we pass a little small tube through your nose to monitor the pH of your esophagus. But ultimately, as GI doctors, we oftentimes move toward endoscopy, which is where we take a camera, and while you're sleepy, we put a camera down to look inside your esophagus to make sure it's healthy, sometimes taking biopsies, which is routine, and make sure that everything looks okay, but also can help diagnose you that way as well.
Oh. So how is this treated medically? I mean, I've heard different things, that it can be medically treated or surgically treated. So how is it treated medically?
So being a medicine physician, we often try to avoid the surgical approach. We often use, first of all, lifestyle modification. So that would mean not eating late at night, avoiding eating, let's say, 3 hours before you go to bed, or rather, not eating 3 hours before you go to bed. You would also avoid drinking alcohol late at night, and just basically modify your regimen. The other treatments include some over-the-counter Zantac, or they're called H2 blockers, or sometimes what we call a PPI is given. These are all medications that are used to decrease the acid levels of your stomach. That's generally what we do as physicians, is the medical approach or the lifestyle modification approach. There is the surgical approach. It's definitely more aggressive than the medical approach, which is where if one has a hernia, which is sometimes a condition of the stomach where the opening is larger than usual, allowing reflux to come up, sometimes they'll actually wrap the stomach around the esophagus to make it tighter surgically, which will then decrease the amount of reflux coming upward into your esophagus.
Wow. Now, if someone's eating really rapidly, I mean, I've seen individuals who sit down for dinner and literally gobble up their food. That's not allowing food to digest properly. that would also cause acid reflux, potentially,
So,
if it's a regular habit.
so it's true. Eating very rigorously, quickly, and eating rich foods are a very significant contributor to acid reflux. So I'm often personally on the run pretty frequently and grab whatever I can.
Right.
And I can tell you that as a physician and a patient, that is not the best thing to do. So eating heavy food quickly without taking your time and resting definitely contributes significantly to acid reflux.
So we talked a little bit about, but by the way, we're all guilty of doing that, but it's not good for us. So let's sit back a little bit when we sit down for dinner or lunch or breakfast and take our time a little bit about eating, slowing down a little bit. And not only that, we probably would enjoy it better on top of that.
I think this is true. I think for many reasons, as a physician, I would recommend taking your time and enjoying your meal a little bit longer, not rushing through it, and definitely not rushing through it late at night would be my suggestion.
I want to go back to one of the questions on treating acid reflux. So you did mention some of the lifestyle changes, but can you talk a little bit more about what are some of the most effective ways to treat acid reflux disease, which is it to avoid those foods and beverages? You mentioned some of them, and I guess you would call those trigger symptoms that would trigger the symptoms. But can we talk about some of the other steps that individuals can take?
You mean from a dietary perspective?
Yeah, I mean, is it eating smaller meals? Is it smaller portions more frequently throughout the day? What would you say?
I think a lot of times, the classic story I hear in my office is the patient who goes out for a late night dinner and has, let's say, Italian food and loves the garlic and the tomato and the heavy entree and the dessert with a glass of wine. All of those things contribute greatly to acid reflux. It's the tomato, garlic, the meats, the alcohol, the cream, all of those things contribute. So any variation on those foods will increase your risk of acid reflux.
And I think the last thing they do after that, and after dinner and drinks, is usually go out and have a smoke.
Yes, oftentimes people will have a cigar or a cigarette, and that will actually cause your esophagus to open up somewhat to allow acid reflux to happen even worse, in addition to the foods you are eating, which makes your symptoms more intensified. So I definitely would suggest not doing that.
So stop smoking is really the best part of that.
Well,
if you can help it.
Any doctor would tell you to stop smoking regardless of their specialty, whether it's a gastroenterologist or an internist. Smoking is detrimental, period. So.
Right. Now, I know there are also some ways that it can help with acid reflux. I mean, even if you're on treatment or going through treatment, or if you haven't gone yet but need to go, please plan on seeing your doctor about that. But meanwhile, there are some other things you can do. And I heard lifting a 40-degree angle or sleeping on a 40-degree angle. Does that help? Does it really help?
There is literature to suggest that lifting the height of your bed 45 degrees can actually decrease your acid reflux. I've already suggested eating 3 hours before bedtime as opposed to just before bedtime and avoiding alcohol. But yes, you can definitely raise the height of your bed 45 degrees. I have some patients that feel it's helpful, and I have some patients who don't.
And then how about weight? Is it a contributor to acid reflux?
So thank you for bringing that up. Obesity will increase your risk of reflux. So having a larger belly increases your abdominal girth or the pressure on your stomach, and when sleeping pushes up on your stomach to increase acid reflux up into your esophagus. So oftentimes patients will say to me, "Hey, Dr. Albert, I actually have worse symptoms." And I say, "Well, have you gained weight?" And they say, "Yes, 20 more pounds." Oh. And then I say, well, that's the problem. So weight loss will definitely decrease your acid reflux.
So if you can tell our viewers anything, what are some of the things you would leave them with?
I would say you should eat a sensible dinner, a well-balanced dinner of meat of some kind or protein, a vegetable. I would avoid sauces, which are rich in all kinds of spices and things that can irritate. I would avoid alcohol late at night. I would avoid tobacco. And I would just make sure you eat earlier. Really is one of my biggest strategies for patients is to eat probably 5:36 would be ideal if possible.
So what do you do for the rest of the evening? I mean, if you eat that early, you still have 4 hours before you go to bed.
You digest your food for those 3 hours. That's what you do.
All right. If individuals are going to have to snack on something, is there anything you would recommend that they may be able to snack on?
Fruits
you
and
do have a lot of snackers.
Yes, we do.
You do,
And I'm
yeah.
guilty. I would say fruits and vegetables really are the most ideal, especially if you're close to bedtime. That ice cream in the bowl before bed is probably not the best idea.
No, lactose intolerance especially. I'm kidding. All right, so the bottom line is don't eat before you go to bed, because once you lay down,
Then
Right.
you're increasing the likelihood that everything is going to come back up and repeat on you,
Right.
and then increase your acid reflux.
wow. So how do you identify triggers? I mean, is it just, not everything that you eat will give you an upset stomach, but sometimes there are things that you can either, what are you eating or munching on, and I mean, we know some of our members in community that come to programs and say, God, it's only been 5 minutes since I've eaten, or I just ate this, and I'm all of a sudden I just want to explode.
So it's a great point. What I would suggest that people do is keep a food diary. A food diary to highlight the foods that irritate your stomach or cause acid reflux. And then if you talk to your doctor, any of us can go over your diary with you and highlight the things that might trigger those symptoms in you.
Right.
That's what I would suggest.
Because, we do hear that a lot, and all kidding aside, but we do hear a lot of that. And I know that a lot of times, even with individual family members, as we're out for dinner, sometimes you're sitting there and just not even 5 minutes later, and they're either keeling over because they've got this excruciating pain, and they, will pop a Zantac or Tegament or
Right.
whatever, and they're fine afterwards.
Right.
Of course, my advice to them is go see your doctor. This is happening too often, and if it happens this quickly, you definitely need to see someone.
That's true. And there's one other thing I failed to mention, which is that I guess pop is a very big contributor to acid reflux. Number one, because of the sugar, and number two, because of the acid component. So any soda, even if it's diet soda, will increase your risk of acid reflux. And a lot of people love soda or pop, and that may not be the best thing for you.
No,
So
I'm sure about that. There are folks out there who I know will drink an entire 6-pack in a day. Not good, no matter how you look at it. Dr. Albert, I do want to share with our viewers that if anyone has any questions or would like to speak to Dr. Albert, please give him a call. You can reach him at Chicago Gastro at phone number 773-368-3164. And your office is here in Chicago on the north side near Sheffield and Wellington. So for anyone who has questions or would like to talk to Dr. Albert, give him a call at 773-368-3164. And I also want to remind our viewers to join us for our colon cancer program. Again, that program is coming up on March 28th at Illinois Masonic Medical Center for colon cancer awareness lecture and so much more. I know we've only got 2 more minutes. Our show here goes by so quickly, and we always have more to say. But Dr. Albert, can you give us a little bit of insight? You're presenting at the colon cancer seminar, and your associate, Dr. Flicker. But I know there's a real big deal that's happening that hopefully we hope to happen, is this colon that you're bringing. This is going to be absolutely awesome. We've got 1 minute. Can you tell us a little bit about that?
So we have a 4 by 6 foot large colon that we're inflating so that people can get a up close and personal look of the colon, what it looks like, ask any question they want, I understand what it does, ask us how it works and what things we look out for, and we would show viewers what things doctors are concerned about, and teach you as much as we could.
That is fantastic. Dr. Albert, thank you so much for joining us once again.
Sure.
And we always love having you back. Again, invitation's always open. Please
you.
join us again for more interesting topics. And to our viewers, on behalf of myself, Dr. Andrew Albert, Illinois Masonic Medical Center, Hispanocare, thank you. Thank you for watching Can Cable 21. Please stay tuned for a lot more coming your way. Until next time, have a good evening.